Start, sir.
Hello everyone, my name is Poonam Sharma. I am in Fortis Hospital today with Dr. Prabhu. So we are going to discuss some topic about gynecomastia or liposuction or rhinoplasty, and first introduce to Dr. Prabhu.
Hi everybody, this is my second video to you, and today we'll be talking about certain cosmetic procedures which pertinent questions will be answered by me so I can clarify your doubts or fears about plastic and cosmetic surgery. Yes, please.
Okay, so we are going to discuss about rhinoplasty today.
Yes.
So what is rhinoplasty exactly?
Okay, a rhinoplasty essentially means a nose job, and this has been practiced for thousands and thousands of years. Interestingly, the word the rhinoplasty had started out from India. In fact, Shushruta was the one who had done a lot of rhinoplasties in ancient patients to create a nose. And the Indian technique of rhinoplasty was exported to the West, and from there it has come back to India. And it means essentially shaping the nose and making a perfect nose for your perfect face so as to make you look more pleasing and appealing to others.
So which kind of person approaching for rhinoplasty? Like they are facing any problem?
Yeah, there are people who are essentially cosmetic, very conscious about their nose. The nose can be either a crooked nose, it can have a small hump on the dorsum, it can be deviated nose, or it can be a depressed or a very small nose for your face, which doesn't make your face look appealing. It can also mean that a person has breathing difficulty, and they also, because of the constant problem of breathing, the nose also deviates. So all this can be corrected in a single sitting, and patient can essentially improve their looks as well as their breathing.
Okay. So Dr. Saab, tell me one thing. So we need to admit for the hospital for a long time for rhinoplasty procedure. It's a very short time admission.
First of all, it's a procedure which is safe, done very commonly, and people can go back home the same day. Only in extreme cases, if the patient is not comfortable, then they have to stay back. After the procedure, I need to caution you about that the patient also have to breathe through their mouth for a few days, because the nose will be essentially blocked and padded from outside. But that's a very minor price you pay so that you can get a good, beautiful nose.
Okay. So how much time take for the full recovery?
The dressings are removed by the third or the fifth day, and then the patient is comfortable. And once the shape is started forming in, there's some amount of swelling which may be mild to moderate, which can be taken care by massages. The results will start coming from a period of 6 to 12 weeks, or we can say even up to a period of 1 year, when the complete beautiful results will be seen. So the patient can be judged better. So one needs to be patient while going through a rhinoplasty before you decide for the procedure.
So how long time patient need to revisit for the showing the nose or for any complications?
There are not many complications in a rhinoplasty, right? So visits, maybe it's on the third day, fifth day, or the seventh day, and then once in every 2 months for the first 6 months. After that, the patient is free, or maybe they can show us the pictures and get any consultation. Essentially, the post-operative care is just doing general massages and taking care of your surrounding skin. That's about it. I also need to tell you about the procedure. There are two types of procedures. One procedure is called open rhinoplasty, another one is called closed rhinoplasty. When you're going to shape up the tip of your nose and you're going to thin the skin of your nose, we have to do it by the open technique, which is a safe technique, and all over the world around 90% of the procedures are done by open rhinoplasty. That essentially means that there is a small cut on the dorsum of on the underside of your nose, which is hardly visible, and the stitches which are applied are maybe 2 or 3 in number, which are completely dissolvable. While a closed rhinoplasty is done inside of the nose, there is no cut, and it can also be done, but it mainly addresses the issues on the upper side of the nose, where the bony prominences are.
Okay. So we discussed about rhinoplasty today. I think it's going very safe procedure. It's only daycare procedure. Patient can go home at time, and there is nothing very complicated procedures. And rhinoplasty is very safe procedure according to Dr. Prabhu we discussed today.
Yeah, I have more than 10 years experience in this field, and I've been doing quite a few cases of rhinoplasty. In my experience, a lot of ladies come for the nose job, and of late even men are coming in for the nose surgeries. One of the major complications one might expect is the unsatisfactory results, but in a safe hands and in a very good environment, people are thoroughly satisfied and the nose becomes as per your wishes. Bye bye.